Hello and welcome to another episode of Conversations with Alison Jaye, The Journey to Here. I'm Alison Jaye. Please remember to subscribe to the channel, like and share. Today I'm going to be speaking to Dr. Sarah Pospos. Dr. Sarah is a psychiatrist based in the LA area. She completed her psychiatry residency as a chief resident at UCLA-Kern and has published extensively on burnout and depression at UCLA, UCSD, and UCSB. As a perinatal and sports psychiatrist, she is devoted to helping others feel their best again when dealing with burnout, depression, and anxiety, and other common psychiatric challenges by incorporating exercise, nutrition, sleep, stress management, efficient time management, especially as she is a full-time psychiatrist and a mum of 2 under 2 herself, and other sustainable lifestyle changes. Dr. Sarah currently serves California patients in her private practice by telehealth, and for non-California residents, she offers additional free resources through her website. The link will be in the description. She has also co-written a few publications. The links to those will also be in this description. She has written about gender differences among medical students, house staff, and faculty physicians at high risk for suicide, being just another one of those. Again, the links to all of those will be in the description. Hello, good afternoon, Dr. Sarah. Thank you so much for joining me here on Conversations with Alison Jaye, The Journey to Here. I appreciate you taking the time to talk to us. And Dr. Sarah, you cover a very wide range of specialties, and I just wish I had the time to go through all of them with you, because as I was reading through it, I was like, okay, I want to speak about this and I want to speak about this. So there may have to be a part 2 to this conversation today, if that works for you.
Yes, absolutely. That sounds
Great.
fantastic.
So I was looking through your website and looking at everything that you do. And as I mentioned, you cover quite a wide range of specialties. You cover depression, and underneath that comes clinical depression, adjustment disorder, premenstrual and postpartum depression. Things that, you know, if we look at it, premenstrual and postpartum are some of the things that once upon a time would have had a stigma attached to it. It's just that, oh, it's just her hormones. Oh, it's that time of the month, without actually giving it the seriousness that actually sometimes it's more than that. It goes deeper and something's wrong. So I love the fact that you cover that. You also cover anxiety, panic attacks, social anxiety, generalized anxiety disorder, mums and mums-to-be, preconception, pregnancy, postpartum. You even work with athletes, aspiring athletes, current athletes, former athletes, working with professionals. Now, this is a big thing: work stress, work burnout, work-life balance, which pre-COVID was, I can imagine, was something that was huge. And if anything positive was to come out of this time, a lot of people discovered a work-life balance. And now that we're starting to emerge out of COVID and post-lockdown and things like that, I know that a lot of people are really working to maintain that work-life balance that they discovered and they got during that time. You also work with students, college students, graduates, and those studying for board exams. So as I mentioned, you just cover a lot, and it's a lot of very important things that people may not really give that much importance to. So thank you so much for the work that you do there. And today, I would like to talk to you about depression, anxiety, pregnancy and postpartum, and also work stress, work burnout, and work-life balance. Again, time won't permit me to go into everything the way I would like to. So we're just going to cover as much as we can, and hopefully there'll be part 2. So, Dr. Sarah, so in my view, I feel as though the word depression is very misused and overused. And as a result of that, I believe that it really does minimize the effects of depression and those people that are really dealing with clinical depression. And to me, it's a bit like the word love. We love everything, don't we? I love this hat. I love this dress. I love that color. I love that meal. And then when it comes to the actual real deep meaning of it, again, it's almost like it doesn't really mean anything because we just love everything, right? And I feel like depression is the same. You say that, oh, I'm depressed today. No, actually, no, you're not. You're not. You're just feeling a bit down. You're just feeling a bit sad. And so my real question, one of my questions, I should say, to you is that a person that is diagnosed as clinically depressed or living with depression, do you find they are the ones that typically would be the ones that saying, oh, I'm depressed, or are they the ones that pretty much tend to not say anything? In your professional opinion?
Yeah, that's a great question, Allison. Like you said, I really like how you put it in terms of depression. Sometimes it could feel like it's just one of the words out there that we throw around a lot, right? So it kind of, you know, makes the clinical depression diagnosis, it's a bit harder in our day-to-day life. So to answer your questions, I've seen both. Just to throw a general statistics out there, depression, as you know, and as the listeners know, is very common. In fact, it's considered the number one cause of disability in the US as well. However, in terms of treatment, roughly there's only two-thirds of those who are depressed who seek treatment. So that's a huge number, right? As you can imagine, almost 66%. So I do in my work see both, those who are clinically depressed but don't realize that they are currently having an episode of depression, clinical depression, or those who experience a lot of depressive symptoms that are just interfering with their day to day to the point that they're seeking care as well, or the point that their loved one encourage them to seek care as well.
Okay, that's very interesting that you would say that clinical depression and really differentiate between the two. So can you explain to us what is clinical depression?
For sure. So clinical depression comes in many forms, meaning, for depressive symptoms for one person might look different from the other. Some common depressive symptoms include, for example, having a sad or low mood most days of the week, right? Perhaps, someone is not enjoying their hobbies as much as they used to. They're not enjoying the activities that they like in the past. It could start to impact their concentration. They might find it difficult to focus, to sleep, to eat. It interferes with their appetite. It may look like different types of thoughts, including feeling excessively guilty about something, beating themselves up over, some thoughts, or feeling hopeless or helpless most of the time, all the way to having suicidal thoughts or suicidal ideation. The important key points in terms of clinical depressions are two things. If these symptoms, one, cause severe intense distress in someone's life, or two, if these symptoms in any way interfere with their day-to-day function. So it could look like, impairing their grades if they're a student, impairing their work, impairing their relationships with their family or others, then it's time to seek out professional help.
Okay, thank you. So, Dr. Sarah, you mentioned that depression is the number one cause of disability and that only 62% of people receive treatment. So, what happens to the other 38% of people? Are they just what would be known as functioning depressed?
Great question. Yeah. So, obviously there's a lot of studies out there in terms of numbers, but roughly, like you mentioned, it's about two-thirds of those who are depressed who seek out treatment. For the rest, unfortunately, they might, one, just not recognize that they're in the middle of depression. Perhaps they think that this is just part of life, right? We're
Mhm.
humans. Everyone has their highs, everyone has their lows. Perhaps they think this is just their lows, and unfortunately, they have to tough it out. Um, Perhaps they recognize that something is going on, but not to the point that it necessitate them to seek out for help. Perhaps they might also realize that something is going on, but they just don't know what to do, where to go, what steps to take to get that help. So Allison, unfortunately, the rest might just deal with their depression on their own, which could be a very, very difficult place to
Mhm.
be, right? Just suffering alone. Sometimes it could look like feeling trapped, like there's no way out. You just don't know how to function, don't know what to do with yourself essentially, and there's no help out there. So I'd like to encourage everyone out there and underlines that depression is again very, very common. It happens to a lot of us. And if you do experience those symptoms that we talked about earlier, to the point that it did or does interfere with your life or creates intense distress, please don't suffer alone. Help is
Mm.
just one click away, one email away, one phone call away. And your mental health is just as important as your physical health.
Yes, thank you. And it's amazing because if you think about it, as much as we say that your mental health is just as important as your physical health, unfortunately, you do have those that just tend to neglect both. And so it's some I can imagine it's a bit of a struggle trying to get people to seek help, especially if, and let me know in your professional opinion if you find this, because of the stigmas attached to depression, mental health challenges, that could be a big reason why some people just don't get the help that they need because they have this facade that they need to present to the world, and they, especially when you have those people that they're the strong friend, they're the strong family member, they're the go-to person. How in the world are they supposed to now say, look, I'm struggling, I'm suffering, I'm feeling this kind of way. I need help. So it's so could that also account for the other 38% not seeking the help that they need?
Definitely, 100%. I'm really glad you brought it up because yes, the stigma around depression as well as mental health in general, right,
Mm-hmm,
could
mm-hmm,
very much deter someone to take that very important step of, hey, I think I do need treatment. I do need that extra help. I do need some extra push to help myself feel like my best again, um, or to function like I was before. And I love how you put it or how you phrase this as high functioning, right? This high functioning individuals or high performers, high
mm-hmm,
achievers, what have you, like you said, perhaps they do have certain standards to them that they hold about themselves, and it's just make it that extra difficult to admit both, perhaps
mm-hmm.
to themselves as well as to others that may depend on them, that may rely on them. That yes, I am having problem right now, and yes, I do need that extra push, that extra help to help me with this problem.
Yes, and excuse me, from some of the things you were saying earlier, what depression could look like, you were mentioned intense and sustained feeling of sadness, emptiness, irritability, loss of interest in things you used to do, low energy, poor focus, concentration, even affecting your decision making. And it's quite interesting that so many things could be affected, like helplessness, hopelessness, extreme shame, guilt, and even insomnia that I was reading. And it's about time, I think, that we paid more attention to when our bodies are telling us something,
Right.
because our bodies will always our bodies know what it needs.
Yep.
and
Exactly.
and there's certain things that when your body's telling you something, it's like your body's waving its hand saying, hi, look at this, this is an issue here. And if only more people would pay attention to that, because I know, like, for example, with myself, Irritability, huge. However, I know that's when I'm iron deficient. And again, it's like people needing to get to know their own bodies, because just because I'm feeling irritable doesn't mean that I'm depressed. For me, it means, and my mum says, like sometimes when everybody and everything gets on my nerves, right? My mum says to me, Alison, when was the last time you took your iron? I'm just like, yeah, I better go take some. I say that to say, so hi mum, and I say that to say that we should, once you get to know your bodies and you're in tune with your bodies, and I don't want anybody to run out there and think, oh, I've got no energy, I must be depressed. No. Whereas what we're saying is get to know your body, be in tune with your body, but pay attention to these things, because they could actually be the warning sign for something bigger, don't you think?
Yes, absolutely, 100%. And also to that note, I strongly do recommend professional help. If you can, perhaps see a psychiatrist, doctor. Why? Because, like you mentioned, um, we can read, for example, the symptom list, but trying to take that information as a whole in terms of the current symptoms you're experiencing and combining it with other things like
Mm-hmm.
your medical history, like you mentioned, perhaps your prior psychiatric history, your family history, what's going on in
Mm-hmm.
your life, if there's any current stressors, how's your childhood look like, and just take into account all that information. There's a lot more nuances or
Mm-hmm.
subtleties to make a clinical diagnosis, and of course with that, um, the the most recommended treatment or treatment approach, um, adding to that layer of complexity in terms of a
Mm.
clinical diagnosis as well.
Okay, yeah, because I was looking at on your website and some of the things you were saying. So there's certain things that could actually mimic depression, like anemia, which is
Mhm.
something that I know that I've suffered with many times, having two blood transfusions. And hypothyroidism may also mimic depression as well. So it all leads into, like you were saying before, just making that clinical diagnosis. It's also important for you to know your medical history. And that's
Mhm.
why it's important for you to get those regular checkups with your doctor as well.
Right.
Because again, we don't want you to just look at this, listening, oh, I'm depressed. And then next thing you know, it's just like, no, you just needed iron because you were irritable, or in some cases it just because your lack of energy and lack of focus is because you're suffering from burnout through
Mhm.
work, or you're taking on too much. So again, it's really important to just pay attention to the warning signs that your body is giving off. And Dr. Sarah, the next thing I would like to go into is anxiety. So tell us, what is the difference between anxiety and depression?
Yes, great question. So, anxiety is also very, very common. In fact, it's the number one, so the most common mental conditions in the US.
Okay.
And it's also very much undertreated. About roughly one third, only one third of those who are anxious are seeking treatment. Although depression and anxiety can occur together, so up to 50%, one in two, of those who are depressed are also anxious. There are distinct from one another. We
Mm-hmm.
already talked about some of the common depressive symptoms. So now let's dive into some of the common anxiety symptoms.
Okay.
Uh, so perhaps that could look like, worry that is one, out of proportion of the triggers, and two, out of control, is really just excessive in a sense that it consumes you 24/7 to the point that it's very, very much out of your control.
Mm-hmm.
Like depression, it could also impact your mood, right? So it could induce feeling like keyed up all the time, feeling on edge, irritable perhaps. It could also affect your sleep, your appetite. It could also have some physical symptoms, including muscle tension, just feeling tense all over. And for anxiety, it may be accompanied by what we call panic attacks. So panic attacks would be set of physical symptoms that comes out of nowhere, out of the blue, all of a sudden, where you may experience, having difficulty breathing, or um, feeling like your heart is racing super fast, feeling dizzy, and things of the likes. So, like depression, it could come in many different flavor. It may look different from one person to another, but those are some of the common symptoms that we usually find in anxiety.
Okay. And just to clarify, we all at some point in time feel a level of anxiety, right? So that is normal, because again, we don't want people to think the first sign of any kind of anxious feeling means they need treatment. It's a normal thing, right?
Yeah, so worry is a normal thing in the sense that, the way our brain perhaps alerts our body, our mind and our body of some perceived danger, right, to look out for. So back in the day, let's say, if I could take you all back, in the hunting days, anxiety or stress is our brain alerting us or of the threat to our survival. So let's say there's a bear lurking in the corner, then our anxiety is our brain telling us, hey, this is a threat to your survival.
Mhm.
But in this modern days, a lot of things can be perceived as a threat. For instance, an upcoming presentation at work, an upcoming big exam, traffic, and the list goes on.
Mm.
The key thing with anxiety, knowing when it's quote unquote clinical anxiety versus day to day worry, again, is similar to depressions. If You could also watch out for those two red flags. One, if the symptoms start to cause severe intense distress in your life, or two, if the symptoms are start again interfering with your day-to-day functions, whether it's your grades, work, relationship, and whatnot.
Okay. And as you mentioned, some of the symptoms and signs of anxiety look like those of depression, right?
Yes, exactly. So both could impact, our day-to-day function in terms of our concentration, right? Ability to focus. It could induce sleeping difficulties, of course, if we're both feeling depressed or if we're worried about something all of the time. Um, and they, as a whole, tend to coexist as well.
Okay, thank you. Because I know for me, contrary to what people think, public speaking gives me anxiety. Like, oh my gosh, I am that person that if I know that I have to speak at something, so because I'm part of a Toastmasters group, and if I have to speak there, we I'm there preparing and researching and doing everything and rehearsing and going over it. And I must admit, I get myself so worked up. It's like, oh
Right.
my gosh, oh my gosh, oh my gosh. Am I gonna, have I got anything sensible to say? Am I gonna make a fool of myself? Am I gonna do this? And it's almost like I have an auctioneer going off in my head, like, how's it gonna sound? Am I gonna make sense? Are they gonna listen? Is it gonna be well received? And do it all of
Right.
that. But that is, and then once I've done it, I'm like, okay, I can breathe. I'm good. So that's normal, is it? My anxiety is
Yeah, so as long as it doesn't sound like it's impacting, your day to day, right? And you did a lot of public speaking, now you're hosting podcasts on top of all the other speaking engagement that you're having as well. So that could be one of the differentiating factors. Although, like with anything in medicine, it's always best to have a visit with your doctor and just get that case by case evaluation if
right.
any one of the listeners are, ever feeling doubtful about their
Mm.
what's going on.
Yeah, because like, so for example, if after I finished speaking and then I was still anxious about it, thinking, oh my gosh, how did they seek it? Are they that would then would that then lead me to think, okay, Alison, it's over. Why are you still feeling anxious about this? And that would that make me then think, something? Let me just go and have a talk with my doctor, because I don't seem to be getting past this anxiety. It just seems to be staying with me. Would that be a good time for me to go and see my doctor?
So um, you could say that in a sense that whenever you're noticing
Mhm.
that the symptoms, in this case anxiety, is affecting your life or your job, your work, your day-to-day essentially,
Mhm.
then I would say it's a good time to connect, to get professional help, to seek out for help or connect with your doctor as well.
Okay, good. Thank you so much. And a big thing here, life as a mother or a mother to be. Now, I think society just expects women to know what to do because by nature you're just made to give, you're by nature you're physically made to conceive, carry this baby, give birth to this baby, and just be Mary Poppins, right? Because you're just supposed to know what to do. But the
Right.
reality is that's not the case. And maybe because our parents and grandparents made it look, and I'm saying look easy, but they may not have made it look easy. They may just have hidden things from us, or maybe as children in our finite minds, we couldn't comprehend or we didn't have the maturity to even be able to see that there's a problem. And then possibly many times you hear people say as they've gotten older and they've got an awareness about certain topics, they're like, oh, you know what? Yeah, I remember when my mum used to be in bed when I was little and I didn't know what it was. So life as a mum and an expectant mother, do you think that there's a lot of pressure put on women to just be pregnant and keep performing and keep going, regardless of the toll that being pregnant physically takes on a woman?
100%, 100%, Alison. I think most times, if not all of the times, the that what you call expectation is, um, you know, just spiral to the point that it's, impossible, right? Impossible expectation. And I would even venture out to add that the pandemic, the recent pandemic, just add another layer to that, for several reasons. So, for instance, in social media, when we scroll, there's endless posts, perhaps, of other quote unquote perfect mom with their quote unquote perfect kid. And we
I
as
know,
mom just
right?
started to think,
And everybody's all
hey,
color coded and matchy matches. Like, ugh.
exactly, exactly. And in our mind, we might go, "Oh wow, my kid doesn't do that, or and I didn't do that. Does that mean that I'm not a good enough mom? Does that mean that I'm incompetent as a mom?" Um,
Hey, Dr. Sarah, you know what? As you say that, sorry to interrupt you and jump right
yeah,
in there, but yeah, now that you say that, sometimes when somebody posts something of their child and you read those comments, it's just like, wow, people are judge, jury, and executioner. And it's
yeah,
literally just based sometimes on like a 30-second clip of an entire life. But yet the
right.
judgment that comes from it. And sometimes you see people saying things and doing things, and just like, hold on, are you there with them? Do you know what the rest of that entire day looks like? Do you just have any clue before you start to throw these real harsh accusations at this woman? Do
Yep.
you actually know? And do you think that nowadays is a big factor as well? As you mentioned it, sorry, that just came into my head.
Yeah, 100%. In fact, perfectionistic trait is one of the a strong risk factor to parental burnout. And to dig even deeper, socially prescribed perfectionistic trait, meaning when we feel like we want to be perfect based on others' judgment, others' expectation, it's
Mhm.
even more of a risk factor for parental burnout that, as you know, could lead to a lot of other things, including right depression, anxiety, and other
Mm.
challenges that might come our way as well.
Yeah, I can just imagine because, it's because you mentioned that where you say sometimes you see this picture of this perfect family with the 2.5 children and the white picket fence and even the dogs in obediently at their feet. And you just look at, and then you look at your children and possibly your house, and it's like they've just literally torn up the whole place. Everything everywhere. One of them's got food in their hair. One of them's trying to choke the cat. one of them's got something they're trying to shove up their nose, you know.
Right.
and then you just go on social media for a little bit of respite, and then you see this perfect thing. I'm sure half the time some of these mothers just probably would just want to throw their phone out the window and say, that's it, I'm done. I don't want to see yours, but the reality is it probably took them like all day to pose for that picture, because the scene probably was the same as the scene in your house.
Right.
So I think we just should stop putting so much expectations on ourselves, especially expectant mothers, and especially those that work, because I'm from a country where women get a year's maternity leave, one whole year, and if you 1 whole year, 12 whole months, 52 whole weeks, yes. That's 365 whole days, and I'm not going to go into the minutes and hours because I don't know, but a whole year. And
Right,
so
right.
over here in the US, when they get 3 months, and I mean, that must be quite an upheaval and emotionally for them. And because many mothers, they're still nursing after
Mm-hmm.
3 months as well. So that all of that exhaustion and all of that, especially if you're a first time mom, or I was speaking to someone today and they got 3 children under 6. So
Wow.
God bless
Mm-hmm.
you. I mean, you yourself got 2 under 2.
Right. Right, right.
So
Yeah.
it must be hard and challenging to still try and paint that smile on your face when you're dealing with all of that as a mom. And it's interesting because before speaking to you, I've never even heard of parental burnout, but it's a real thing, right?
Mm-hmm. Yeah, yeah, definitely. Parental burnout, it's, if I may put it this way, it's a cousin of a job burnout, right? Or work burnout. Initially
Mm.
or traditionally, the definition of burnout has always been associated with work until more recently. I think Roskam is the researcher that throw in this inventory or this assessment of parental burnout assessment. When we think of it that way, I think it makes sense because being a parent, being a mom is the fullest time job of it all, right? Because
Mhm.
as a parent, as a mom, there's no lunch break, there's no vacation, there's no time off, there's no quitting. So all the things that comes with the job burnout, with work stress and whatnot, perhaps is even more compounded as a
Mhm.
parent as well.
And I would go as far as to say, if you are a parent and you have a good structure around you, a good support network around you, take advantage of them. Because you don't need to be super mom. I'm convinced that no one pulls open their blouse and there's a big S on their chest for super mom, superhero. Leave that to Superman and Clark Kent. That's all good. That he was built for that. But if you
Right.
have, but if you have that support network around you, like family members that will babysit for you, as while you can, go get your hair done, or just go to have a spa treatment, or take yourself out for lunch, but have a nap, like a good 2 hours sleep or something. So, because I think a lot of the times we try to be martyrs, don't we? Like, I can do it. I'm a mother. This is what I'm supposed to do. Yay. I am woman strong. Hear me roar. But the reality of it is in your head, you're probably falling apart. You want to strangle the cat, meowing too
Right.
loud, and it's getting on your nerves. And and so if you have those resources,
Yep.
take advantage, don't you think?
Exactly, exactly. And I'm glad you brought it up as well, Allison, because burnout, as a concept, is an imbalance between challenges and resources, like you said. So if we can in any way increase those resources by, like you said, accepting help whenever someone, an extended family member, a colleague, a friend wanted to help hold the baby, perhaps, well, you can do naps, do a little bit of self-care, do your hobby, get some fresh air, for a walk and whatnot. Just take it. Although it could be very, difficult, and it's harder perhaps to practice as a mom, with what you just said earlier as well.
Yeah. And also I think if you're if your husband or the father is there, I know that's not the case with everyone, but if you are in a relationship or a position where he is there, let him look after his children for a moment,
Right.
a couple of days. Because it's like, I remember, was it Chris Rock or somebody that says he hates to hear when men say, I'm babysitting. Like, no, they're your children. You're looking after your
Right.
children. You're partly responsible for these children to look after. And I think sometimes, again, as mothers, there is the temptation to just want to do it all. And some of these fathers would relish the opportunity to have that one-on-one time with their children without helicopter mom hovering and coming in. No, you're doing this wrong. You need to hold them like this. Let them figure it out and let them bond with their children too, right?
Yep. Yep. Definitely.
So
Definitely.
yeah, so then let daddy do something.
For sure. For sure.
Because again, reading the statistics, depression is the number one cause of disease burden in women of child bearing age. And then we also go on to say menstrual dysphoric disorder affects 5% of women of childbearing age. Can you explain to me or our listeners what that is?
Premenstrual dysphoric disorder.
Yes.
Yeah, for sure. So we can refer to it as PMDD, to shorten it a bit. It's a bit different from what we often know as PMS,
Mm-hmm.
premenstrual symptoms, right? In a sense that it affects much more areas in your life than PMS.
Okay.
So to backtrack a little bit, during our menstrual cycle, for all of us, all the listeners out there as well, as you can imagine, there's a fluctuation of hormone that's happening during that cycle, that time period. And the way our body respond to that hormone fluctuation is different. So the symptoms doesn't necessarily or is not necessarily caused by the amount of hormone itself, but the way our body responds to those fluctuations. What are some of the symptoms? Again, like with depression, like with anxiety, it could differ from one person to another, but some common symptoms include irritability, perhaps feeling more sad than usual, more anxious than usual, which could again affect our sleep, our concentration, our focus at work, our appetite. And if these symptoms interfere in our day to day or causing us intense distress, that's when we quote unquote called it PMDD, or premenstrual dysphoric disorder.
Okay, so there is a difference between PMS and PMD.
Correct.
Okay, thank you. And I was looking at it and it says that depression is the most common complication of pregnancy. Who would have thought that? Because most people would have thought the most common complication of pregnancy would be something physical that you can see, like for example, well, not so much that you can see, something like high blood pressure or um, low blood pressure even, or some kind of illness or something like that would actually hamper the baby's well-being. No, I don't think many people would have thought that depression was the most common complication of pregnancy.
Right, right. And when we took a deep dive into it, perhaps it makes sense, right? Because first of all, depression is multifactorial. A lot
Mhm.
of things could cause depression, right? And especially in the setting of pregnancy, just like in our menstrual period, pregnancy is a time where our hormones fluctuate. So again, some people might respond to that fluctuation a little bit differently. And
Mhm.
on top of that, like you mentioned, there are a lot of physical changes associated with pregnancy as well, the pregnancy period, and a lot of other physical conditions that might occur out of our control during those 9 months.
Mm-hmm.
Um, in addition to, perhaps the worry of when the time that the newborn comes, what are we going to do with the baby? It's going to be a big life change and whatnot. So a lot of things, combination of things happening at once on top of all this hormonal imbalance, bodily changes and whatnot. It may just increase someone's likelihood to feel depressed during this period.
Wow. Thank you for that. That's interesting because and you also mentioned that up to between 80 and 97% of women in their first and third trimester suffer from insomnia. So on top of all of that, they're not getting enough sleep. And I know that most people think and say that towards the end of the pregnancy it's uncomfortable, so they can't sleep anyway. So some people just probably think, well, yeah, of course they're not going to be able to sleep. It's going to be uncomfortable. But it's not just towards the end of pregnancy. This statistic shows in the first trimester that women can suffer from insomnia as well. So surely that must have a lot to do with their mental state.
For sure, 100%. Sleep is very, very important for mood, right? It could easily impact our mood, our anxiety level, our energy level, our ability to concentrate during the day, and a lot of other things in terms of our mental health outcomes. And like you said, towards the third or towards the later end of the pregnancy, perhaps the uncomfortableness, just all those physical symptoms might contribute to that insomnia or sleep problems, as well as during the first pregnancy. Throughout, we might also experience things like nausea, vomiting. Some people have to go in and out of the bathroom, including during nighttime. Some people might experience carpal tunnel, just uncomfortableness in, pain everywhere, discomfort that might physically affect the quality of their sleep as well. On top of all the worries, right, that might come in their mind when they're just expecting that baby during this time period. So it's very, very complex. And like you said, it's very, very common during pregnancy.
Okay. And also, one of the statistics is 80% of women experience what's known as baby blues or postpartum. Can you explain what postpartum is?
Yeah, postpartum, as the name suggests, just means the period after delivery, after partum, right? Postpartum. And in terms of postpartum blues, it's also commonly known as baby blues. So typically a few days after delivery, some moms might feel a lot of emotions, including, feeling irritable, just feeling very sad, not knowing what to do, fear of not being enough as a mom, just a lot of different mixed emotions within those first few days. And it's very, very common. 4 out of 5 moms might experience this feelings during this time period.
4 out of 5. That's a high number.
Absolutely. Yep. Very, very
My
high.
goodness, because I know in the UK, I don't know if they still refer to it as that now, but it used to be called postnatal depression. So that kind of gave it more of I felt like it gave it more weight, because especially because they had the word depression after it. So I just wanted you to give that explanation as a postpartum, because I think it's a word that we've all heard, but maybe some people just don't really know what it means.
Right, absolutely. And it's also important to differentiate postpartum blues or baby blues with postpartum depression, because the postpartum depression is a type of clinical depression that happens during this time period of after giving birth or after delivery. Postpartum blues typically happen within those first few days, up to 2 weeks, let's say, and most of them resolves by itself. But postpartum depression, of course, is more severe. It could last longer, and it may happen even after those initial few days.
Wow. So that's also something to really keep an eye on if you're around somebody that's just given birth. Just keep an eye on them to see if, because I'm by listening to you, it sounds like for the first few days, some anxiety
Mhm.
or baby postpartum baby blues is it's normal. It's a bit natural because you're, especially if you're a brand new mother or a mother with other children, now you have another baby, and again because of the hormones fluctuating. But if you're around someone that it seems like they're down for an extended period of time, please keep an eye on them, check on them, and maybe encourage them to get some help,
Yes.
because the truth is we just never know. We just never know. And 4 out of 5, that's actually quite an alarming number. I wouldn't have thought it was so high, to be honest. And then I was also reading that 23% of bipolar symptoms begin in pregnancy. Please talk to us about that.
Yeah, so bipolar, for the listeners out there, um, could be differentiated from unipolar depression, right? As the name suggests, uni means one, bi means two, which means that for bipolar depression, there are two phases uh, of mood. One is the depressed phase, so the down of the downs. And then at some point in their life, they may also experience a manic phase, which is the opposite of depression, right? So, for instance, during the manic phase, someone might experience, euphoria. They might experience like they're invincible, they're on top of the world. They might out of character, perhaps driving recklessly, spending monies that they don't have. They might talk faster or louder than
Mhm,
usual, and
mhm,
people, loved ones, might have problem interrupting them during this manic phase. They might not need to sleep at all and still function the next
mhm.
day, full of energy and be very productive. So those are the two phases that someone with bipolar depression might experience, the downs and the highs. And with regards to bipolar in the pregnancy or postpartum context, uh, the pregnancy and postpartum period is just a um, this period, if I may say, increase someone's likelihood to experience this mood fluctuation, especially if someone have a bipolar history in the past before getting
Mhm,
pregnant. This
mhm.
period is just, increase their chances of having another episode because of those reasons that we already talked about earlier.
Okay. So thank you for explaining that. And another thing that you go on to mention is um, about perimenopausal women are 2.5 times more likely to also experience depression. So again, for our listeners, perimenopausal, what does that mean?
Yeah, so it just means the period around menopause, right? So menopause for everyone is different in terms of the exact specific age. Um, but it's, as a whole, perhaps towards the later uh end of life, not later end of life, but when older age, if I may put it that way. In terms of symptoms, it's associated with physical and mental symptoms, right? So there's a lot of physical changes that someone might experience during this period, um, as well as that, again, hormone fluctuation that we already
Mhm,
talked about earlier. So a combination of these factors, the physical changes, the hormone fluctuations, and how one's body is responding to that. Social changes, there's a lot of changes in someone's life within this period. For example, um, changes with job, someone might choose to retire or start
mhm.
thinking about retirement, being an empty nester, perhaps experiencing loss in personal, their family situations and whatnot, or friends, loved ones, close ones. So all of this, as a combination, just might increase someone's likelihood to get depressed as well.
Okay, yeah, and that makes sense, especially as you mentioned, somebody's looking into retiring. It must be quite a daunting thing for most people, because it's just like, okay, what am I going to do? because I think a lot of people also attach their purpose in life to the job that they were doing, and
Right.
feeling like if once that's gone, once that's removed or taken away, what am I going to do? And not just retirement age, because I remember many years ago, it was round about the recession in 2008, and I heard a young man, because he worked in investment banking, and that was during the time when a lot of investment houses were just folding.
Mm,
And sadly, he tied so much of his identity into his work, his job, that when that happened, he took his life.
mm,
And so
wow.
you're saying that. So if we also look at people that are coming up to retirement age, and if they've spent so many of their years and their identity is this job, this thing that
Mhm.
they've been doing for so many years, then yeah, I can excuse me, I can quite easily see how it could affect a person mentally and maybe
Right.
cause them to spiral into a depression.
Definitely, definitely. So that associating one's identity with what we do is very natural, but like you said, when it gets taken away, especially if it's unplanned or in some ways unintentional, it could very much induce stress, right? It's a very, very huge life changes, and it
Mm,
could for some spiral into other challenges as well
yeah.
emotionally.
Yes, and moves us nicely into life as a working profession. Dr. Sarah, and talking about working professional, work-life balance, work burnout. So quite recently, we were talking about leave and just how busy some industries are, and taking time off just for vacations and just to relax and decompress. And somebody had mentioned to me that there was a young lady, and I believe she's probably in her mid to late 20s,
Mhm.
and was talking about the fact that she hasn't taken a day off in 3 years, and that they were quite busy, and she had plans for that weekend and had to cancel her plans to go into work. And the fact that she didn't seem annoyed by it, she actually, it was like quite proud of
Mm,
that. And in my head, I'm thinking, you haven't taken a day off in 3 years. I probably would be a heap in the corner somewhere, sitting and rocking my thumb if I hadn't, just rocking and sucking my thumb if I hadn't taken a day off in 3 years. But it was almost like this sense of achievement
mm.
that she hasn't taken a day off in 3 years. And I was actually quite astounded by that, because surely that cannot be good.
Right, right.
That,
Definitely.
and surely not only it can't be good, surely that can't be healthy.
Yep, yep. Thank you for highlighting that. Absolutely. So self-care is very, very important, right? Although in practice, with the hustle culture and with everything else that's going on, it's could be very hard to for us to implement that. Um, but like you said, it might have downstream effects to someone's health, both
Mhm.
physical as well as, of course, mental health. When we just work 24/7 without paying attention to ourselves, while neglecting self-care, and that downstream effect could affect our work productivity as well down the road. So it's definitely not recommended.
Yeah, and surely it can't be sustainable either, because I'm sure you can only do that for a certain period of time, and that's when, of course, um, burnout comes into play, don't you think?
Exactly, exactly. And sustainable is exactly the word that I would choose as well. Um, because going back to burnout and the definition, burnout is often associated with work stress that is enduring, right?
Mm-hmm.
That's persisting. And this type of work stress that often leads to burnout include high amount of workload. It include endless, meaningless tasks. It include work that is out of our control, where we don't have the autonomy or the control over our work, as well
Mm-hmm.
as, of course, that work-life imbalance factor
Mm-hmm.
too.
Yes, and I'm sure we've all been there, and I'm sure at some point in our careers we've all worked with that person that just wants to just throw meetings on the calendar, just a meeting about the meeting that we're going to have for the meeting that we've reached. Like, whoa, everything doesn't need to be a meeting. You can just put it in an email. Let me know it. And so, to your point, sometimes we can't, because we can't control what other people do and how other people work, but we can, like you said, take that time to do some self-care. And
Mm.
sometimes it's okay to decline a meeting and to say, is it something that you can just put in an email to me?
Yes, definitely. So boundary, like you said, is very, very important in preventing as well as resolving burnout once it happens.
Mm-hmm.
And then in terms of self-care, absolutely. In fact, I'd like to recommend for the listeners two practical, portable stress management techniques that might help whenever you're feeling, overloaded with work tasks,
Mm-hmm.
going after meeting after meeting after meeting, just that back-to-back commitment. The first one being deep breathing. So
Mm-hmm.
intentional breathing using your diaphragm or your belly. Uh,
Okay.
w- what I like to do is to count to six while inhaling, count to six while pausing, and then count to six while exhaling, and do this a couple of times. So what it does, it switch our body from fight or flight system to the
Okay.
opposite, which is parasympathetic system that could, as a benefit, lower our heart rate, lower our respiration, lower our muscle tension, um, making us feel less anxious and just refocus on that brain areas, prefrontal cortex, that enable us to think more clearly. Um, so that I think, could be really helpful and utilized in this
Okay.
case of, being overworked at the office, so to speak.
Okay. I was
Uh,
trying to write that down, so I may need you to say that technique again. It's like, I definitely need it.
And the second technique that I'd recommend is progressive muscle relaxation, or PMR,
Mm-hmm.
which is what we often recommend in psychiatry. So for that, essentially, we'll go muscle group by muscle group from the top of our head all the way to the bottom of our feet. For instance, for the muscles on top of our head, we're going to intentionally tense it for 10 seconds and then relax it, intentionally relax it for 20 seconds before going down to our forehead, to our cheek, to our jaw, to our neck, shoulder, and so forth. Similar to deep breathing, what it does, it induce that parasympathetic response. And because anxiety is often connected or associated with muscle tension, by relaxing our muscle, we're also lessen that anxiety, that anticipation anxiety, and improve our mood, our energy, our sleep later on, and many other mental health outcomes.
Okay, sorry. I was trying to do that one where you see, like, you tense the top of your head. So if I was making faces, sorry, I was trying to see, how do I tense my head? So I was just like, oh, I thought, let me give this a try. So I'm definitely going to listen back to take down some of these techniques because, yeah, I think I need some. Yes. Because I know that I have been one of those people guilty of sometimes not pushing back at work and just saying yes to everything because you know what it's like. You're at work, you want to prove yourself, right? You want to
Right.
make sure that that your employers, your bosses, your colleagues can see that you're doing a good job. But sometimes in doing that, it's a case of there's now no boundaries because then they
Mhm.
feel like it's one of those things where rather than them see, okay, let me try and do this myself, it turns into that, oh, you know what, it's okay because Alison will do it. Alison will do it. And I don't mean like just me, but I use myself in that example because I'm sure there are other people out there that would be like they sometimes I'm sure they feel that way where people
Mhm.
are just putting on them and on them and on them and on them. And because they've spent so long saying yes, they now don't know how to say no.
Right, right.
And so
Definitely.
is there anything that you could recommend for the Allisons in this one? Because
It
I'm just
it
not just
it's very, very tricky, like you said, especially in a work setting, right? It could easily turn into endless commitment if we're
mm,
not careful. So I think, like with anything, it takes practice,
mm-hmm.
saying no,
Yes.
um, first and foremost. So, you know, perhaps what would be helpful is to try to incorporate that self-care, just try to focus on what you actually are feeling, get in tune with your body, your emotions, and say no when you have to. The second tip that I have would be, while you're practicing your no's, phrasing it in a more strategic way, if I may put it that way. So perhaps you could remind them, sure, I could do that, but I'm focusing on this project. Would you like me to take care of this first or that first? So
Mm,
some of those subtleties may soften the blow, so to speak, whenever you need to say no to a
yes.
request.
Yeah, I like that because especially sometimes if you're able to say, I'm just working on this right now, but I'll get to that. And sometimes people think, oh, you know what? No, it's fine because I need it right now. So that's almost like the easy way for kind of. Don't you think so? Though that's a bit of the easy way to say no without saying no. It's almost like
Right.
what they say on social media at the moment. Tell me you're saying no without telling me you're saying no.
Essentially, yeah.
Right.
Right, right.
I just got this whole list of things to do before I get to your thing. So if it can wait, then great. Chances are they'll be like, yeah, no, I'll take care of it. It's like, great. So yeah, so like you said, it's like that it's boundaries, isn't it? And learning
Mhm.
that and not feeling guilty. That's a thing though, isn't it? Not feeling guilty when you have to set boundaries.
Yep. Yep. Which is a big thing and very, very difficult to practice as well, right?
Mm. So yeah, I can just well imagine. So it's interesting that we're talking about this just a couple of weeks after having a conversation about a young lady that just felt so proud that she hasn't had a day off in 3 years. And I'm just thinking, okay, you're young now, but what about 20 more years of doing that?
Mm,
What would your mental state look like then?
right,
So
right.
yeah, I just think we should stop glamorizing
Yep.
people not taking a day off. And I mean, don't get me wrong, there are times when business needs it, but that should be the exception and not the rule, don't you think?
Exactly, exactly.
Wow, that's right. So we've covered quite a lot, and I don't want to see what I'm going to do here. I don't want you to burn out, Dr. Sarah. So I think my last topic that from your vast area of expertise that I would like to just really touch on is work-life balance. What would you recommend and suggest people do to make sure that they have a healthy work-life balance?
Yeah, absolutely. So it could be very tricky, right? Especially when we're talking about something so systemic, in a sense that, if the office culture is like that, we
Mm,
as one individual, might find it difficult to change the whole system. Uh, what could help, what I would recommend is, take some time, grab a piece of paper and a pen
mm,
and try to really explore, really write down your purpose. So your why, not everyone else's, but your why. And
Mm.
this purpose, this why of yours, could look different for every season in your life. So for
Yeah.
instance, my own why back then during my medical training might look different from my own why right now, with two
Mhm,
under two, and that's okay. After you discover your purpose, then take another minute to see if your current situation, and that could mean your work, because of course your work is a big part, a huge part of your life, is
mhm,
aligned to that purpose or not. So the answer could be yes or no. If yes, then amazing. You know, during the harder days of work, because all of us are human, all of us are going to have those hard days
mhm,
inevitably. During the hard days of work, perhaps try to reflect back to your purpose and see how, this particular work, particular job could push you even further to be more aligned with that purpose of yours.
mhm,
But if the answer is no, then you have some options. One, if possible, then you might tweak, you might adjust, you might change your work situation and find one that's more in line with your purpose.
mhm,
Or if not, then you might intentionally um, focus or intentionally set aside some time despite your work schedule to really get that self-care going. Perhaps try to select commitments or select activities outside work
mhm,
that is more aligned with your purpose, and try to push yourself to be more aligned to that core values of yours, that purpose of yours, despite your current unchangeable quote unquote work situation. And down the road, try to find or adjust your work situation to be more aligned with your purpose later on when it's more
mhm.
permissible.
And I like that you put to readdress, or not readdress, I'm sorry, revisit your list of your whys, because when you're in college, your list of whys are going to be different. And if anybody's curious to be like, what, my why, my huh? Why are you doing what you do? It's really that simple, right? Why are you
Yep.
doing what you do? What is your end goal? What are you hoping to achieve? Why are you doing what you do? It's a very simple question, but I believe it's a very simple question that will yield some complex results.
Yep.
Do you know what I mean? Just like why and because. And so maybe you put, your why column, and then you put the reasons that you're doing what you're doing. And then, as you mentioned, what you were doing, why you were doing what you were doing when you were at college is going to be very different to, like, as you said, now that you're a mother of two under two. And then once your children get a bit older, your why will change again. And so it's important to keep readdressing, revisiting, and just looking and taking that moment and that step back to reevaluate why you're doing what you do, because you may, and I think it might be good if you kept like a journal and you dated it. So, and then if you go back like 5 years later and you look at what you had put down as your why, and see how things have changed, and some things may have changed, some things may have stayed the same, and write down another list of whys, and again just keep revisiting it, and it may be a good roadmap for you to see how far you've come and the changes and things in your life. So I like that, Dr. Sarah, that you said make the list of your whys, and that would help in your work-life balance. So with everything that we've discussed, why should someone see a psychiatrist?
Yes, great question. So, with for some of you out there, the listeners, some of the tips that we discussed about today might already be enough, might already be helpful.
Mhm,
But for some of you, you might need that extra push, that extra help, to be able to get out of your current situation and feel like your best again.
mhm,
And it's feeling in the middle of a depression or in the middle of anxiety, feeling depressed, feeling anxious. It could be a very, very difficult place to be, very scary place to be. very lonely place to be. You might
Mm,
feel like there's no hope, there's no light at the end of the tunnel. It's so far away.
mhm.
That you might not be able to see it right now, right? You
Right.
might
Mhm.
feel like no one would understand or is understanding the struggle, all the struggles that you're going through right now. You might feel clueless in terms of how to move forward, how to go about life, how to function even. Um, and I just want you to know there is a light at the end of the tunnel. Help is out there. It's just one click, one email, one phone call away. Please don't suffer alone. Hope is all there. If you're in California and you don't have a psychiatrist, please feel free to reach out to me at my website, lifestyletelePsychiatry.com, or I'm also on Instagram with the same handle, Lifestyle Telepsychiatry.
And I'll
If
put
you
the link to your website in the description as well.
Perfect. And if you're not in California, I still do offer additional free resources that might help you as well with your well-being at my website too.
Perfect. Dr. Sarah, thank you so much. And that is a great point to end on. Do not suffer in silence. Do not suffer alone. Help is there. Help is available. And it's just what did you say? A click, a phone call, an email away. You don't even have to leave your home anymore. You can just drop Dr. Sarah a line, and help is right there and readily available for you. So, Dr. Sarah, thank you so much for your time. I really appreciate and value the insight that you have given to many areas of life where people can suffer from depression and may not even have thoughts about it, especially mothers and mums to be, which is very important. Thank you so much for your time. Thank you for joining us here on Conversations with Alison Jaye, The Journey to Here. Thank you so much, Dr. Sarah.
Thank you so much, Allison. Such a pleasure to be here. And to all the listeners, please also check out Allison's other episodes. They are truly life-changing, and check her out on her website as well.
Oh, thank you. I appreciate that. Thank you so much, my dear.
Thank you.